Hello cruel world, my name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Why is mental illness so prevalent in prison? Both the obvious and the more subtle reasons. What's it like working as a psychiatrist in prison? And can you enforce medications to prisoners? I'll be answering all of these questions and many, many more in this episode. This is part 2 of a 4-part series about mental illness in prison and how it's dealt with. At the end of this episode, I'm going to be telling you about the shocking case of Ms. P, who had an extreme form of deliberate self-harm. She was cutting herself to the point that there was blood everywhere. It really was quite intense. If you've not done so already, please check out part 1, where I've talked about the huge waiting lists in prison to transfer people from the healthcare unit to secure psychiatric hospitals. I also talked about the tragic real-life suicide of Sarah Reed, who was a 31-year-old mixed-race woman who took her life in 2016, and that was related directly to the problems I talk about. So let's get started. Why is mental illness so rife in prison? Well, there's the obvious connection. So that's the environment of prison itself. There can be lots of bullying, there can be violence, there's a lot of drug use, there's a lot of drug debts, so people getting beaten up for not paying for the drugs that they've used. People are often threatened, people can be scared for their lives, there's lots of gang beefs. So, I mean, you probably know all these things. The environment of prison itself can be very traumatic, and that can cause a new mental illness, or it can exacerbate an already established mental illness, such as depression, anxiety. If somebody has something like post-traumatic stress disorder, then the trauma and the experience of being in prison can exacerbate symptoms like flashbacks, nightmares, and occasionally I've seen prisoners who've been locked up or contained in the past. That's part of their trauma. So for example, I've seen a few clients from Albania who've been captured and forced to work in drug houses. They've been physically chained up and beaten. So being locked in a prison cell kind of makes them re-experience or relive those traumas, which exacerbates post-traumatic stress disorder. So that's the obvious connections. What about the less obvious, more subtle connections? Well, these are confounding factors. So people who end up in prison are more likely to have separate issues that also lead to mental illness. These are things like homelessness, poverty, struggling to get unemployment, suffering from abuse. So those are factors that cause mental illness, and separately they cause people to commit crimes and end up in prison. Another big connection, I think, is learning disabilities. So somebody with a pathologically lower IQ is more likely to be exploited, more likely to be used by gangs who try and befriend them and exploit them, use them to do things like make transactions when they're selling drugs. Also, somebody with learning disabilities is more likely to get caught, so they're less likely to be adept at lying to the police, less likely to get away with their crimes. Another huge issue is difficulty accessing healthcare once you're in prison. So it is no secret, I'm sure you've heard, that prison mental health services are already massively stretched and underfunded. I've worked as a visiting psychiatrist, where I've gone into prison as a guest, and I've also worked there twice a week in a clinic, and I can say that mental illness is rife. I've seen that personally. On top of that, in a previous episode, I interviewed a man called Chris Atkins, who's a journalist who served several months in prison related to fraud. He's also got a book released. You should go check it out. And he told me that he saw many mentally unwell prisoners talking to themselves, often disorientated, so it was definitely rife. I would also say that another issue is that there are limits on how we can treat mental illness in prison compared to, for example, hospital. So to be specific, in prisons you cannot use the Mental Health Act, so you cannot medicate prisoners against their will. So if somebody's psychotic, for example, I saw a man who was trying to pull out his own teeth and he was crying constantly, and I think he was responding to voices, auditory hallucinations, but he had no insight, so he refused to take the tablets that I'd prescribed. By the way, if you're interested in learning more about hearing voices, go check out my previous episodes about that exact topic somewhere on this channel. I should just say that you can force medications in an absolute emergency as a one-off, but you can't force regular medications that will get somebody better. So for this man, for example, we could not inject him with antipsychotic medication, whereas you can once they've been transferred to hospital. But as I said in the last episode, that is a problem. There are huge waiting lists. It takes months of people waiting to get into these places. This particular man, it took 2 months. And that was 2 months of him suffering from voices every single day he was being tortured. And the reason, or one of the main reasons, that you cannot use the Mental Health Act in prison is there aren't the same kind of safeguards. So for example, if somebody has an allergic reaction to these medications, which I should say is very rare, there's fewer doctors and nurses around compared to hospital, it's a much harder task and it takes much longer to get paramedics into prison to get the prisoner and get them out, because obviously there are security checks and time is of the essence. If you're having an allergic reaction, you could die. Another huge factor is spice. So spice is a synthetic cannabinoid and prisoners smoke it to get high, but it causes agitation, causes paranoia, sometimes it even causes psychosis. I will talk about spice and educate you a little bit more about that in a future episode in this series, so watch this space. So my USP, I think, for this channel compared to other true crime channels is that I'll talk about my own perspectives. So I'm now going to tell you pros and the cons of working as a prison psychiatrist, and I'm going to compare this to, say, another field. The most other common field for a forensic psychiatrist is obviously working in a secure forensic unit for mentally disordered offenders. So I'm telling you this in case there are any budding forensic psychiatrists out there and you're considering this career, although we both know you ain't about that life. I can see it in your eyes. So I'm going to start with a con. A con of working in prison is the logistics of actually getting into prison and the amount of waiting that you have to do. This is especially the case if you're a visitor. So if you're doing a one-off medico-legal visit as opposed to being a regular member of staff, then there's a long wait. So when I worked as a regular prison psychiatrist in a female prison, I was a regular staff member, so I had my pass, which I'd show at the gate, and I could go through. I didn't need all the security checks. Although having said that, sometimes I'd still have to wait. If contractors or builders, for example, were going in, we had to wait for them to do all their security checks, check their ID. It could take half an hour, it could take 45 minutes. And you never know it's going to happen, so you might be late for your first morning meeting unless you get there super early. And even on the way out of the prison, even as a regular member of staff, in the prison that I worked, you had to shine your badge to a camera on the side of a locked door. They'd ask you who you were. If everything checked out, they would unlock the door from their control room. But sometimes they were busy, God knows doing what. Sometimes you'd have to wait several minutes. Sometimes there'd be a big queue of you going out. Another issue is that you have no kind of status, especially if you're a visitor. Nobody really looks after you or cares about you. So I'll give you a specific example. A lot of prisons, there are no parking facilities, especially in big cities like London. So on a few occasions, I've had a double legal visit appointment, which has been booked for 2 hours, and I've paid for my parking for, say, 2.5 hours. I've ended up waiting for so long that I've gone way past my parking time limit and I've got myself a parking fine. Obviously, I tried to appeal this, but they're not renowned for their reasonableness in terms of the parking appeal committees. It's like trying to reason with a flat earther. And by the way, if there are any flat earthers watching this channel, I don't think my material is for you, no offense. Obviously, since then I've learnt my lesson, so now I'll pay, for example, for 4 hours of parking. And part of the reason for this delay is the security. It's really thorough, it's really time consuming. It's basically like an airport search every time you go into a prison. And different prisons have different rules. So for example, a category A prison, which houses the most dangerous and violent offenders who are at the highest risk, they have a really long, lengthy search process. You're not allowed to take in a watch, you're not allowed to take in a belt. And little naive me, when I was a young forensic psychiatrist, I didn't always know that. So I put a lot of my stuff in a locker in a different building, then I'd wait in a queue, sometimes over 45 minutes. I'd get to the very front to show them my ID, and then I was told that I was not allowed in with a belt, so I'd have to go back to the locker in a separate building, join the end of a queue. It's just a messy, slow process. And woe betide the psychiatrist who wears baggy trousers to come to an assessment and has to remove their belts, because as we all know, it's really difficult to carry out a proper psychiatric assessment if your pants are falling down. I should say, to be fair, that occasionally there are some prisons that I've visited who are extremely well organised. There's very little waiting. You just go in and out quickly on the way in and the way out. And so it's only fair to show some balance. That does happen. Sometimes in other prisons, even after I've done the assessment, there's still a lot of waiting on the way out because they want to transfer all the legal visitors, solicitors, barristers at the same time, so you basically have to wait till everybody's done. It's quite boring, it's quite frustrating, and you're not allowed to take anything in with you that is contraband. So you're not allowed to take in your phone or any books. You're literally only allowed the piece of paper and the pen that you're writing with, so you're literally sitting there with nothing to do. somebody like me who's already got a problem with being really impatient, it can be very boring. So an advantage of working in prison is that you get to leave your work and your cases in the prison. You don't have to take them home. So in contrast, in psychiatric hospital, you're fully responsible for the patients in the long term for many years. So if something happens out of hours, say if the patient's on leave and they go AWOL, or if there's a serious assault on the ward, or if your patient's in the seclusion room, then either you have to deal with it or you have to organise whoever's on call to deal with it until you next come into the hospital. So occasionally I would sometimes get phone calls out of hours interrupting my home life, which, as you know, I spend mostly rescuing puppies and helping old people cross the road. Whereas in prison, you're not really fully responsible. The whole point of a patient in hospital is for you and your team to rehabilitate them, to get them better. Whereas in prison, they're there for punishment, and if you're helping, you're like an external agency who comes in and helps them. You're not fully responsible. Another advantage, which is kind of connected to that, is that prisons, or the one that I worked in, tended to shut at 4 p.m. in terms of movement and appointments, so you can't really have appointments after that, and staff are expected to leave by 5 p.m. because the office buildings are shut, the lights are turned out, the clinic rooms are locked. So there's like a definitive end to your day. Whereas in hospital, even though I was often paid to work till 5 p.m, most days I would stay behind later because there's so much to do, constant stream of paperwork, and it was the same with the other doctors. A con of working in prison is that, I kind of mentioned this before, you have no status really. Even if when I was working there regularly, the prison was run by the prison guards and the governors, they were in charge, they made all the important decisions. And I think it's fair to say that some prison psychiatrists and the rest of the mental health team are not particularly treated very well, especially some of my colleagues that worked in men's prisons, probably more than mine. And I'm not just saying this for my own ego, but it's also about the freedom and the use of resources. So for example, in hospital I had my very own office, even had my name on the door, and I was set up. It was my area. People, if they wanted to get hold of me, they knew where to find me. Whereas in prison, I was given an office space and I was given a clinic room, but it was shared with tons of people, some of whom I never met because I was only there a few days a week. So there'd be lots of junk hanging around. I remember once, randomly, a whole pile of bed sheets, a ton of bed sheets, like enough to fill a quarter of the clinic room, were just dumped randomly in the clinic room. I could barely open the door, and nobody seemed to know where they'd come from or who put them there. I phoned the estates department, obviously, but there was loads of different members of staff. Nobody really took responsibility, so it took about a month of me phoning every day before they were removed, before they eventually disappeared out of the blue. Another example is that more than once there've been contracted work in the prison while I'm trying to work there. So I've had like builders drilling in the walls behind me whilst I'm in clinic trying to talk to prisoners about their traumas. As you can imagine, it's not a productive environment for that kind of thing. And I have to say, the attitude of the governors is that's kind of your problem, you deal with it, we've got other stuff to sort out. A pro of working in prison compared to other places for a psychiatrist is there's a lot of variety. So in hospitals I'd see very similar cases. Most defendants had psychosis, most of them had committed violence, most of them were in there for long-term rehabilitation. Whereas in prison you see lots of different cases. There's a much higher turnover of cases that you see them for short periods, then they move on. You see a range of disorders from depression, anxiety, PTSD, even gender reassignment, which I talked about briefly in one of my previous videos. A disadvantage of working in prison is that you're almost constantly bothered by prisoners when you're just walking through the prison, through the main gates between, say, the buildings. To be fair, I can understand why this is. It's because the prison system is amazingly inefficient. So if prisons have complaints or requests, even basic requests, organising illegal visits or putting more money on their phone accounts or trying to access a particular piece of property from their items, they need to make an application, and their applications are often ignored or there's a massive delay. So I can completely understand why it's frustrating for some inmates, but what they do is they just try and corner you and get you to help sort out their problems, which I couldn't do. Prisoners would always approach me, and often when I was walking around, I think they guessed that I was a doctor, and I think I must have just given out that doctor vibe, by which I mean I was Indian and I wore a suit. And even though I went to medical school, so all psychiatrists are qualified doctors, different from psychologists, see my video on misconceptions about psychiatrists, interesting video. Even though I went to medical school, I've not worked in physical medicine for around 15 years, so I've forgotten a lot of the knowledge, I've lost a lot of my skill. But I was still approached regularly by prisoners for physical health issues. Doctor, my shoulder hurts. Doctor, is this wound on my foot infected? Doctor, can you prescribe some painkillers for a toothache? And even if I did have the knowledge and the expertise for these issues, I was just walking down the corridor. Didn't have the patient's medical notes in front of me. I didn't have the prescription charts to write a prescription. Didn't have any equipment to examine them. Initially, I think I was a bit naive, and I did want to, and I did try and help them to direct them to the right person. But it was really hard, almost impossible to find the right person. So I had to learn to set boundaries. Otherwise, I'd be constantly followed and harassed when I was walking through the prison. And to be fair, this kind of stopped after a few weeks, so I wonder whether the prisoners were testing me. They wanted to, see if I was weak. It was in my nature to be polite, and it felt quite rude to dismiss or ignore prisoners, especially if they were in pain. However, I soon learned that if I showed this kind of weakness, they would all bother me, so I had to firmly but politely say no. I have to say some of my colleagues didn't do this politely and can be quite rude to prisoners. It always made me feel uncomfortable. I always thought that was unnecessary. Another pro of working in prison is generally there's less paperwork. So in hospital, you're constantly writing reports. You have to update members of your team. You have to write reports for the probation services. You have to be in contact with the community psychiatric team who will be looking after your patients once they're discharged after hospitals. You have to constantly update risk assessments. You have to write reports to the Ministry of Justice for patients who are under restriction orders. They're very high risk, extremely dangerous patients, such as those who have committed murder. There's like an endless stream of paperwork in hospital. There is some paperwork in prisons, but it's much less, and you can do it much quicker, which means that you can get on with your job, which is seeing mentally ill people. A con of working in prison is that you have much less of a team, and you have less resources, less support. So for example, in hospital, in my multidisciplinary team that I led, there would be social workers, psychologists, occupational therapists, nurses, whereas in prison, I was quite lucky because I had some psychologists in my team, and there were psychiatrists such as myself. Never worked with an occupational therapist, never worked with a social worker directly. There were some social workers that would help out prisoners, but we hardly ever met them. So for example, somebody who comes into hospital, who's there for long-term rehabilitation, who's homeless, I personally knew the social worker. I would see them on a weekly basis. I'd have a conversation. I would ask them to put the wheels in motion to find out accommodation for this person after they leave prison months ahead of their discharge. Whereas in prison, it's much more sloppier, disorganized. There are professionals, but they're not on your team. You just have to email them with your requests. Sometimes you'd never hear back. Sometimes it'd take months for them to reply. The whole system, in my view, is very disconnected, very disjointed. And as a psychiatrist, I felt like I had very little authority because, as I said before, the prison doesn't belong to me. The prisoners don't belong to me. I am an external agency that is there to help. I don't make any of the big decisions. The final pro of working in prison, and something that you might not expect, is that oddly, I felt safer in prison than I did in hospital. Now, obviously, it goes without saying that violence does occur in prison. There are gang beefs, there are drug debts, there are fights, etc. But these generally happen on the prison wings, and they very rarely happen in the areas that I worked in, such as the prison clinic or the healthcare unit, or the visitors hall when I went for legal visits for medico-legal assessment. I mean, I have seen the occasional scuffle. I'm not saying there's no violence, but there's less violence because it's away from their turf, but also because there are lots more prison guards and observations in these places as opposed to the prison wings. Put it this way, if I needed to beat up another prisoner who dissed me in the chow hall, I would not do it in a clinic room. Also, we have panic alarms in our interview rooms. I've never personally pressed one, but they're always there, and the prison officers will bundle in and beat up, if necessary, the offending prisoner. The other thing I'd say is that generally prisoners were always on their best behaviours, especially when I was doing medico-legal assessment. I think they were trying to make a good impression, so I would write a favourable report to the judge. And when we did have prisoners that were extremely violent, including those that were so unwell that they were, for example, hearing voices, couldn't contain their symptoms, they generally tended to be locked up in the healthcare unit or in the segregation unit, which is known as SEG, which is similar in its structure to the healthcare unit, but it's for punishment and to contain prisoners that are violent, not for psychiatric treatment. Also, as well as being separated from the rest of the prison, the violent prisoners often were on a 1, 2 or 3 man unlock, which meant they need 1, 2 or 3 prison officers to be allowed out of their cells. So I guess what I'm saying is that violence did occur, but it's a lot more contained. There were big beefy prison guards who would step in and take over if there was any kind of scuffles, as opposed to nurses in hospitals. Contrary to popular belief, we don't actually have guards in hospitals, even though they show them in TV shows and the films. They're usually big, muscly men. I don't know if it's different in the States. And in a previous video, I told you about a man who I saw on a medico-legal assessment who got really agitated because I'd been waiting for hours. I think I saw him almost 3 hours after the appointment time. No idea why, I just kept waiting. By the time I got there to see him, we barely had 10 minutes for the assessment, which was not long enough. He had complex mental health issues. He really wanted to see me, he really wanted treatment. He understandably got angry, got agitated, he kicked off. I was bundled out of the room. One of the other prison guards pressed the alarm. Lots of other people ran in. He was medicated, he was restrained. It seemed very unfair to me. I tried to speak up on his behalf, but I was kind of just pushed away. Because it's not my jurisdiction, I'm only a visitor. Medium secure units where I've worked in, by contrast, I'm not saying they were always violent, but it happened far more often because all the patients were kind of walking around, they had their own space and they were a lot riskier and it just felt a bit more dangerous. There was often tension in the air. Put it this way, I've been punched twice in my life, in terms of work anyway, and both times were on psychiatric units and I've never been punched in a prison. By the way, if any of my viewers are ex-cons, I'd love to hear about your experience in prison in general and specifically about mental illness. Either people that you have seen who are mentally unwell or your experience yourself. For example, how easy it was to get the attention of the mental health 𝐿𝐸 Okay, now I'm going to tell you about the case of Miss P. So like all my cases, I've anonymised her and I've changed some demographic details to make her less identifiable. So Miss P was overweight, she was unemployed, and she was in her 30s and she had purple hair. She had diagnoses of borderline personality disorder. Check out my other videos on personality disorders if you're interested, and also learning disabilities. So she used to have this explosive rage and she would cut herself. Most inmates would cut themselves superficially or scratch themselves, just sometimes to relieve frustration or, sadly, to garner the attention of the prison mental health team. But Ms. P was different. In the community, she used to carry around this Stanley knife and she'd sliced her own arms or thighs so deeply that in the past, on a few occasions, she actually needed blood transfusions and needed plastic surgery. So obviously this is very concerning behaviour. She actually went to prison for possession of this exact Stanley knife, which to me seemed a bit unfair because she wasn't, as far as anyone could tell, intending on hurting anybody else. So it's very quick psychoanalysis of Ms. P's disorders and their relevance to her self-harming. As I mentioned, she had borderline personality disorder, which is associated with emotional instability, inappropriate anger, impulsiveness, and frequent mood swings. So she'd have these explosive arguments with strangers. And on top of that, Ms. P had learning disabilities, which meant that she struggled to process or express her frustrations in a healthy way. And on top of all of that, I think that her background kind of fueled the flames. So she was rejected by her own family, who gave her up into foster care when she was a toddler, and she was just rejected and not liked much in society. Men would use her for sex, drug dealers would use her flat as a crack den, and even professional services would turn her away. So she would often turn up to accident and emergency and her problems would be deemed to be secondary to social issues, which basically means we're not going to help you, go away. She frequently had arguments with her mother, and so I think it's fair to say that Ms. P was very vulnerable, but also at the same time very challenging to support. So when she was in prison, we kept her in the healthcare unit. So this has a higher level of observation, there are doctors and nurses available, and sharp objects were removed for her cell, obviously. However, Ms. P still somehow managed to hack away at her arms and legs with plastic cutlery, even a pencil. Often she would get stitched up and she would intentionally pick away at the sutures, and once she even rubbed toilet water into a wound so that it intentionally became infected. So it was kind of like a constant battle, us versus her. She would try to make herself ill or injure herself. And often when people would tell her off or set boundaries, that would set her off. So for example, if she was not allowed to go to arts and crafts therapy session on the wing because of her behaviour, or if she was told off for using the phone past her allotted slot, it all depended on the way that she was handled and spoken to, and she could easily just become really agitated. So for example, if you asked her politely that she needs to have a shower, then more often than not she would listen. But if you told her what to do, which is kind of the norm in prison for prison officers, she would become extremely angry and frustrated. And Ms. P would often intentionally pick fights or insult people, staff members, other prisoners, just to provoke a reaction so that they would insult her. And I wonder whether that was all related to her harsh upbringing. So the incident that I'm talking about, another prisoner made fun of her being overweight by stuffing pillows down her bra, and they did an impression of Ms. P. This made her really upset. She liked this person, she thought they were friends. So she went back to her cell, she opened up some stitches, she put her fingers into the wound so it bled everywhere, and it was so severe she got carted off in an ambulance by the time I even got to the healthcare unit. When I got there, prison officers were literally mopping up the floor in her cell. They were wiping splatters of blood off the wall. They were dressed in hazmat suits. It kind of looked a bit like a Beastie Boys video. After Ms. P returned to prison, we had to try really hard to contain her risk of self-harm. So we had to use lots of different compromises and also strategies. So for example, we made sure that she only worked with 2 or 3 specific prison officers who knew her well and who she liked. All of them happened to be males. She seemed to have a specific disliking to female staff. And the prison officers and myself and the staff, we all had to adapt our attitude. So we were never harsh, and we treated her with kid gloves. So instead of answering back with an insult or telling her off, even when she sometimes provoked us. So in a way, it was almost like treating her as a child. So if she made a racist or a horrible comment, instead of answering back, we would say something like, "That was unnecessary, you've hurt my feelings, let's think of a way that we can work together." And that kind of worked with her. And as a treat, she would have escorted sessions to the arts and crafts sessions. They had to be escorted because she was often bullied by other people, which made her feel worse. We did that once a week. Psychologists also saw her regularly, but it was a fine line, because if you saw her too regularly, she'd become quite dependent. And she was quite a needy person, so we had to set clear boundaries. So the psychologist in our team would see her for a maximum of twice a day and for a maximum of 25 minutes per time. And we'd let her know in advance when her time was running up, because she was very needy. If you tried to leave the conversation, if she's in a certain mood, she would get really agitated and she'd try and physically and emotionally keep you there. But if we told her, like, we gave her a 2-minute warning, then that tended to work. And I have to say, all these strategies were a lot of hard work, but they worked. So overall, her self-harming didn't disappear, but it improved. It used to be an almost daily basis, and we got it down to once or twice a month, and it was nowhere as severe as it used to be. But there was a cost, and the cost was a huge proportion of time and manpower and resources from myself and the psychologists and the nurses and the prison officers, which actually unfortunately meant that a lot of unwell patients were deprived of some of our time and some of our support. But we had no other choice. Ms. P was eventually discharged back in the community into what I think is a chaotic and unsupported lifestyle. She was sent back to supported accommodation where there was staff there, but I think she probably would have struggled because she'd burnt so many bridges. She'd been kicked out of so many different accommodations in the past. Honestly, I still worry about her. I wonder if one day I'll read an article about Ms. P committing suicide eventually. That's the kind of patient clientele that we have to deal with. So, I'm going to tell you about next episode, which I'll be talking about my experience of working in prison, specifically things that I wasn't expected, what it feels like going into a prison, whether it's scary or not. And I'm going to tell you about the real life case of Mr. S, who was labelled as a snitch. He was badly beaten, and he eventually developed a psychiatric illness because of this. So before you go, please subscribe to our YouTube channel. Not only does it help me out immeasurably, but it makes all food taste delicious, guaranteed. I'm very interested to hear about your experiences if either you or somebody you know has been to prison or ever visited. You can hit me up on the usual social media channels, including Facebook and Instagram. Until next time, please tell your favourite people about Psych for Sore Minds. They deserve it. Spread the love, stay euthymic, and please, whatever you do not forget, I love you.